Hey, Dr. Lobert here, and I just wanted to review a couple of things. You've had a crown or an onlay today, and I just wanted to review a couple of things that patients always call into the office and ask us about after their treatment. So the first thing is what can I eat? Temporaries are made out of plastic. They're very easy to break, and if you bite too hard on one side, obviously you can crack it. So we want you to stay away from the temporary area when you're chewing. We want you to avoid anything real sticky and no gum chewing. Those are like kind of the cardinal rules. The other thing that can affect temporaries is something really, really hot, like really hot spaghetti or real hot pizza, or something like really cold ice cream or frozen yogurt. The more you stay away from those foods during the temporary stage, the better your tooth will feel. The next thing is, how are the gums going to feel? So the gums, because we have to put a little tiny string around the tooth to dry it when we make the mold, sometimes the gum can feel a little bit upset and a little bit angry for a day or two. That should all go away. Most of the time an Advil or a Tylenol is all you'll need to be able to eliminate that. The third thing is any bleeding that's going to occur. So sometimes when we prepare a tooth, depending on where the damage and the cracks or the decay is on the tooth itself, sometimes it's a little bit deeper underneath the gum, and occasionally you can get a little bit of bleeding from around the tooth and around the temporary. Now, if you're on a blood thinner, that's the only time when you can expect to see sometimes blood after you brush your teeth or floss. Finally, the last thing that I want you to know is that what should I expect after the tooth has been prepared and treated pain-wise? So, great question. Typically a tooth, because sometimes it can get upset from removing an old filling or some damage or decay or removing cracks around the tooth, sometimes that nerve inside the tooth, it can get a little bit upset and angry. That's because it's inflamed. So inflammation is always best treated with ibuprofen. That's a great medication that handles typically all dental inflammation or swelling. All it is the nerve is in there and it's getting a little bit angry, and so when you take an ibuprofen, everything kind of calms down and settles down. Things to be aware of: if it's a throbbing pain that occurs more than 3 or 4 days, almost like a heartbeat, that's something that you'd want to call the office for. Lastly, your bite. Because you're numb after a procedure, sometimes when you bite your teeth together, we can't exactly tell perfectly if everything feels just exactly flush. Now, we give it our best effort with carbon paper, but ultimately when the anesthetic wears away and everything returns back to a normal sensation, sometimes when you bite your teeth together, you'll feel like, hey, that's the only tooth that touches on this side, let's say. So if that's the case, give the office a call. It's literally a 30-second to a minute adjustment to pop in, adjust it, and you'll be away to the races. So that's how to take care of your temporaries, and usually any questions that come up are all related to those. Otherwise, if you have any other questions, feel free to drop us an email or give us a call. Julie, Elisa, or myself will be more than happy to answer. Thanks so much, and have a great night.